Picture this. A young puppy, all wiggles and boundless energy, suddenly kind of hesitates at its food bowl, maybe even whimpering when it tries to open its mouth.
Yeah,
This isn't just a phase of fussy eating, right? It could be something called craniomandibular osteopathy.
exactly. And that's what we're diving into today. Craniomandibular osteopathy, or CMO for short. It's a really fascinating bone disease. Affects the head bones, specifically in young dogs.
Right, and we've got some pretty detailed medical info here that lays it all out. So our goal today really is to break down CMO for you.
Hmm.
If you've ever been curious about some of the, more unusual health challenges our dogs can face, especially in certain breeds, this should give you a really clear picture.
Yeah, what it is, what causes it, the signs, diagnosis, and what can actually be done.
So let's get into it then. Fundamentally, what is craniomandibular osteopathy?
Okay, so at its core, CMO is basically where extra bone grows on the skull. It's important to know it's not cancer.
Not cancer. Okay.
And it's not inflammation causing it either. It's just extra bone. What's interesting is where it grows. It's quite specific.
Specific bones. Which ones are we talking about?
We're primarily looking at the lower jaw bones, the mandibular rami, that's the technical term.
Right.
And then often parts of the back of the head, like the occipital and parietal bones, also those little bony structures around the eardrums, the tympanic bullae, those get involved too, and sometimes part of the cheekbone, the zygomatic part of the temporal dome.
Wow. Okay, so it's a pretty defined area on the head. And you mentioned this extra growth usually happens symmetrically, like both sides.
Precisely. Yeah, in most cases, you see this extra bone forming on both sides, often like a mirror image. And it's definitely a condition of the musculoskeletal system, bones and muscles.
Okay, that gives us a good baseline. Now, who gets this? Is it any puppy, or are some breeds, more likely?
Oh, there's a very clear pattern here. Breeds, definitely. The Scottish Terrier, Cairn Terrier, and the West Highland White Terrier, the Westie. Those three are definitely the most common.
All right, all terriers.
Yeah.
Interesting. Are there other breeds, maybe less common, but still possible?
Yes, absolutely. While those terriers are sort of the poster children for CMO, it does pop up elsewhere. We see it in labs, Great Danes, Boston Terriers, Dobermans, Irish Setters,
Okay.
English Bulldogs, Bull Mastiffs, Shelties, even Boxers. So yeah, not just terriers, but they are the main group.
And the timing. You mentioned a young puppy earlier. What's the typical age?
Usually young, growing pups, generally between 4 and 8 months old. That seems to be the key window when signs start showing up.
4 to 8 months.
Okay.
It doesn't matter if it's a male or female puppy?
Doesn't seem to. Nope. Males and females seem pretty much equally likely to get it.
Huh.
But there is an interesting note in the sources. Something about neutering potentially increasing the risk slightly.
Really? Why would that be?
It's not entirely clear. Maybe something hormonal influencing bone development during that growth phase. It's just noted as a possibility to be aware of.
Yeah. Okay, so we're looking at a young puppy, probably one of those terrier types, maybe 4 to 8 months old. What's the first thing an owner might notice? What are the clues?
Usually it starts with pain around the mouth area. And it tends to get worse over time. It's progressive. And alongside that, difficulty opening the mouth fully, it becomes harder and harder for them.
And if they can't open their mouth properly, eating must become a real challenge.
Oh, absolutely. Picking up food, chewing it, prehension and mastication, we call it, becomes tough.
Yeah.
And that can be serious. If they can't eat enough, it could potentially lead to, starvation if it's not managed.
Wow. Okay.
Yeah.
That's serious. So what would a vet see during an exam if they suspect CMO?
Well, a few key things. Often there's muscle wasting or atrophy. You might notice it in the temples, the temporal muscles, and the main chewing muscles, the masseters.
The jaw muscles look smaller.
Yeah, exactly. And the vet might actually feel it too, like an irregular thickening along the lower jaw bones or around the jaw joint, the TMJ area.
And that difficulty opening the jaw, is it really obvious?
It is. That's a big one. The inability to fully open the jaw. And sometimes, even when the dog is under anesthesia for an exam,
Well,
they still can't open it fully. That really tells you it's a physical restriction from the bone. Sometimes you might also see an on and off fever or even both eyes bulging out a bit, bilateral exophthalmos. Less common, but possible.
okay, so pain, trouble eating, muscle loss around the head, limited jaw opening. It paints quite a picture. Why? Why does this happen? What's the cause?
The current thinking, and it's pretty strong, is that it's hereditary, genetic.
Ah, runs in families, runs in breeds.
Exactly. It seems to be passed down. In Westies specifically, it's thought to be an autosomal recessive trait,
Meaning?
meaning a puppy needs to inherit a faulty gene copy from both parents to get the condition. If they only get one copy, they might be a carrier but not show signs.
Gotcha. And maybe in Scotties too, but maybe differently.
Yeah, likely genetic in Scotties as well, but the exact inheritance pattern might be, well, more complex perhaps, not necessarily simple recessive.
And there was something about other bone issues in young terriers.
All right. The sources mention that if you have a young terrier puppy already showing signs of some other bone disease, maybe in their long bones like their legs,
Yeah.
you should keep a close eye out for CMO signs too. Suggests maybe a connection sometimes or a shared predisposition.
Okay, so a vet suspects CMO based on all this. How do they confirm it? How's the diagnosis actually made?
Well, a big part of it is ruling out other things that could look similar. Differential diagnosis,
Right. What else could it be mistaken for?
Several things, like a bone infection osteomyelitis. But that's usually not symmetrical. It's often more localized, and you often see bone destruction, lysis, not just growth.
Okay.
Plus, infections don't usually have that strong breed link, and there might be a history of a wound or something.
Makes sense. What else?
Maybe traumatic periosteitis, that's inflammation of the bone surface from an injury. Again, usually not symmetrical, less widespread, and there be a history of trauma.
Right.
Bone cancer, neoplasia is another thought, but that's typically in older animals, usually one-sided, more destructive, and might have spread.
Different age group, different pattern.
Exactly. And then there's something called calvarial hyperostosis. That's also extra bone on the skull, but usually different bones, like the forehead, top, back of the head. Doesn't typically hit the lower jaw like CMO does.
So location, and symmetry are key clues. What about blood work? Can that help?
It can add pieces to the puzzle, yeah. Sometimes levels of an enzyme, serum alkaline phosphatase, ALP, are up. Inorganic phosphate 2 indicates increased bone activity.
Uh-huh.
And sometimes, interestingly, you might see low gamma globulins. Those are immune proteins or high levels of another protein, alpha-2 hyperglobulinemia. Not always, but sometimes.
Any other lab tests?
Well, in unusual cases, maybe tests to rule out fungal infections, as they can sometimes cause weird bone issues in the head, but that's less common.
So the real confirmation comes from actually seeing the bones, right? Imaging,
Yeah.
x-rays.
Absolutely. Skull x-rays, radiography, that's crucial. They can show that characteristic, sort of uneven, maybe bead-like new bone growth on the lower jaw or around the eardrums, usually on both sides.
Okay.
You might see quite extensive new bone around the TMJ, the jaw joint, sometimes even bits of the ear bones fusing to the jaw.
Wow. Are there, like, more advanced scans?
Yeah, a CT scan can be really helpful. It gives a much more detailed 3D view, especially for looking closely at that complex jaw joint area.
And what about a biopsy? Taking a piece of the bone. Is that common?
Generally, no, not for a typical case. It's usually reserved for when things look a bit weird or if the vet really needs to be sure it's not cancer or a tricky infection.
And if they did do a biopsy, what would it show in CMO?
It would typically show normal bone being replaced by this abnormal, kind of coarse, fibrous bone. You might see signs of bone breakdown too, osteolysis in layers of the bone. Sometimes the marrow space gets filled with fibrous tissue and blood vessels, and occasionally you might see some inflammatory cells right at the edge of the bony bits.
Okay, so we've covered what it is, who gets it, the signs, causes, diagnosis. Now the big question, what can actually be done? How do you treat CMO?
Right. Well, the really important thing to understand here is that treatment is focused on managing symptoms. It's palliative care.
Palliative, meaning you can't cure it, you can't stop the bone growth?
Unfortunately, no, not really. Trying to surgically shave down or remove the extra bone, it might seem logical, but it usually just grows back pretty quickly. Weeks, sometimes. So surgery isn't usually a long-term fix.
Okay, so if surgery is not the answer, what do you do?
Nutrition is absolutely critical because of that difficulty eating, right? So a high-calorie, protein-rich, soft food diet is key. Sometimes even blended into a slurry or liquid consistency just to make it easier for them to get enough calories and nutrients.
Makes sense. What if they still can't eat enough, even with soft food?
In more severe cases, yes, sometimes a feeding tube is needed, surgically placed, could be a pharyngostomy tube in the throat, esophagostomy in the esophagus, or gastrostomy right into the stomach. It just ensures they get the nutrition they need while the condition is active.
That sounds intensive, but necessary in some cases. What about the pain? It sounds painful.
Oh, definitely. Managing pain is a cornerstone of treatment. Analgesics, pain relievers, and anti-inflammatory drugs are crucial.
Like what?
NSAIDs, non-steroidal anti-inflammatory drugs, are the mainstays. Drugs like daracoxib, carprofen, meloxicam, faracoxib. There are several options vets use. They help reduce the pain and any inflammation around the bone growth, making the dog more comfortable.
So it's really about support, nutrition, and pain control. What about follow-up and the long-term picture?
Yeah, regular vet checkups are essential to monitor their weight, make sure the pain meds are working, adjust things as needed, just check their overall quality of life.
Okay. And prevention, since it's genetic.
Right. The advice is pretty clear. Avoid breeding dogs that have already produced affected puppies. And certainly don't breed dogs that have CMO themselves. That's the main way to try and reduce it in future generations.
And what happens with the disease over time? Does it just keep getting worse?
Actually, often, no. The pain and discomfort tend to decrease as the puppy finishes growing, as they reach skeletal maturity, usually around 10 to 12 months old.
Oh, really? That's helpful.
It is. And in some cases, the extra bone growth might stop progressing or even regress slightly, shrink a bit once they're fully grown.
So the overall outlook, the prognosis,
Yeah.
what does it depend on?
It really hinges on how badly the jaw joint, the TMJ, is affected. If there's severe permanent restriction of movement even after they mature, that can obviously impact their quality of life long term. And sadly, in the most severe cases where eating is impossible and pain can't be controlled, euthanasia might have to be considered as the kindest option.
So it's a serious condition, needs careful management, but there's hope it might improve as the dog gets older.
Exactly. The goal is always the best possible quality of life through managing pain and ensuring good nutrition, especially during that tough puppy phase.
Well, this has been incredibly informative, a really deep dive into craniomandibular osteopathy. It's clearly, a significant issue, this proliferative bone disease in young dogs.
Uh-huh. Especially those terriers.
Right? Causing that jaw pain, trouble eating,
Yeah.
all because of that extra bone. And while there's no magic cure, the focus is on palliative care, comfort, pain relief, nutrition.
And it really makes you think, doesn't it? How understanding these genetic links in specific breeds, like with CMO, it empowers owners, and it's so important for responsible breeding choices.
That's a great point. And for you, the listener, maybe you own one of these breeds or you're just interested. What questions does this raise for you about your dog's health? Definitely something to keep in mind. And, always worth a chat with your vet if you ever have concerns.